person. Have any of you guys ever used a gait belt before? Okay, so you kind of know. Basically, the gait belt is an assisted safety device that can be used to help a patient sit, stand, or walk around, as well as to transfer them from a bed to a wheelchair or from the wheelchair back to the bed. They will be secured the gait belt around the patient's waist. Make sure you don't put it in the upper abdomen, across their breasts, or down along their hips. It should be right on their waist. Okay, and when used properly, a gait belt reduces the chance that a patient might accidentally fall. The belt also takes some of the physical stress off the caregiver and reduces the chance injuries could hurt her, injure her back.
So when you talk to you,
Never fails.
Thank you, Caroline.
Gait belts are usually a few inches wider and made from either canvas, nylon, or leather with a buckle at the end, sometimes loops for holding that. There are two main types of gait belts. The standard design with a metal buckle featuring loops and teeth, and then there's also a quick release design that has a plastic buckle that snaps in place. So a gait belt is not appropriate for every patient situation, but it can be a good choice if the patient still has some mobility and is only partially dependent on the caregiver for support. It is important to remember that a gait belt is a mobility assistive device, and it should not be used to lift or move the patients outright. If the patient is not able to partially move themselves, a powered, portable, or mounted lift device should be used to safely transfer them. Even if the patient does have relatively good mobility, be cautious of using a gait belt if they are recovering from a condition or surgery that affects the abdominal or lower back region, such as back surgery or an abdominal aneurysm. Also use caution if the patient has any feeding tubes, catheters, or other apparatus near the abdominal area. Their physician will be able to advise you on whether a gait belt is a good option for those patients. And most of you guys have already known what your patients already consist of. Mostly Foley catheters around here and stuff like that. Walkers, wheelchairs. So no matter what you're using the gait belt to do, verbally let the patient know that you're going to put the gait belt on them and walk them through the transfer process. If you are lifting the patient, it also helps to count down to the lift so you can both rise and sink. So it's really important to coordinate with your patient and they know exactly what's going to happen to them. So always explain everything first. To help someone stand while wearing a gait belt or to transfer them from one place to another, first help them into a sitting position. So if they're lying down, get them into a sitting position or whatever, and put the gait belt on them. Then stand facing the patient with your back straight and your knees bent. And that's the real key to keep from hurting your back, is make sure that your back is straight, your knees and your legs do all of the work. You should have a wide stance, but it shouldn't be too wide. Just make sure that it's a good solid stance, about shoulder height. They don't go way out or too narrow, but just make sure that your stance is right down straight from your shoulders. Okay, and be sure to support as well as lifting from your knees rather than your back. Use both hands, firmly grasp the belt on either side and straighten both knees as you lift the patient. And while you're doing this, of course, you're coordinating and talking with the patient the whole time. To help someone while walking a gait belt, stand behind and to the side of the person. Okay, using an underhanded grip with your palm towards you, firmly grasp the loop on the back of the gait belt. Support the patient as they walk, keeping the pace that they set. So it's really important that you allow them to set the pace and just walk gently and just kind of support them as they go along. So caregivers need to learn proper use of a gait belt for mobility challenged patients. This is a task that is basic to caregiving. A gait belt is a long belt. Oh, we already went through all of that. Okay. Let's see. Physical therapists emphasize that a gait belt is not to be used in lifting or carrying a patient by the waist. The gait belt is not meant to be placed around the patient's chest, breast, or abdomen. So, and make sure you don't also go around the hips either. A gait belt fits around the patient's waist while the patient is walking or moving with caregiver assistance. Don't place a belt over incisions, stitches, tubes, or lines, and never use on a pregnant woman, or pregnant patient, it says. The proper use of a gait belt will prevent the caregiver from handling the person by the arm, wrist, or underarms and injuring a weak patient. So you know how sometimes you'll reach around and grab a patient by the hands? This is what's going to help you prevent from doing that. Grab that belt. And also when you go to lift a patient, make sure you grab them up around their upper body and not jerk on their arms or shoulders. The gait belt fits around the patient's natural waist snugly. Be certain that there are 2 fingers between the belt and the body so it won't squeeze the patient. Typically, gait belts are very long to fit all sizes and shapes of individuals. It is best to tuck the dangling end of the belt to prevent trips or tangling. Fasten the metal bucket like you would a military belt. Make sure that the teeth catch and the buckle closes. Always inform the patient that you are using a belt and what you are going to do. So read and follow instructions that come with the belt before you use one. I don't know if you guys have all those instructions or not, but to help a seated patient rise and walk, remind the seated patient to put your nose over toes when rising. So you want as they're sitting, they should be leaning just slightly forward where their nose is above their toes. That way they have that little forward momentum. Snug with their gait belt if needed. Be careful that it is not too tight or too loose. Do not position the gait belt in the area that we had talked about, the breast, the abdomen, the upper arms, upper chest, things like that. The caregiver should walk beside the patient, put one hand flat on the patient's back over the gait belt. One hand there is there to monitor movements. You may use an underhand or overhand hold with one or both hands on the belt, but do not hold on to the patient's clothing or skin. Be careful that putting your fingers or whole hand under the belt does not tighten the belt, causing it to bind or be uncomfortable for the patient. Be careful not to swing or pull on the patient's belt. A caregiver often uses a gait belt on a patient who depends on a cane or a walker or who may easily lose balance. Make sure you walk at the pace of the patient on the patient's weak side and to the rear of that weak side. And just take your time. There's no rush. You know, I think sometimes we all want to get them going and get them where we want to, but it's more important to just take it nice and slow and easy, because you sure hate to have a fall and break a hip. Be careful grasping the whole belt with your hand might cause to pull on the gait belt unintentionally. The gait belt is supposed to be there for steadying a weak patient, not to push, pull, or drag them. Walk at the patient on the patient's weak side. Loosen and remove the gait belt when the patient is seated again comfortably. Okay. So here on this next one, it's how to transfer using the gait belt. So make sure that the patient always has appropriate feet wear. So no slippers, no flip-flops, something that's good, secured, and tight that they won't step out of as well. Or if they have the loafers that their feet fit in snugly, that's good too. But make sure that it's no flip-flops or slippers or anything that they can slip out of. And then make sure you wash your hands.
Thank you.
Oh goodness. Okay, so always wash your hands. Explain to the patient what you're going to do, and then apply the belt while the individual is in a comfortable sitting position. If the patient is lying down on the bed or has poor sitting balance, apply the gait while they are laying down. But if they're able to actually sit on the edge of the bed, that's better. Make sure the belt is applied tightly enough to prevent it from riding up or down, but loosely enough so you can grip it and comfortably. So So again, there should be at least 2 fingers between the belt and the patient. Always 2 fingers. If the individual complains of a dizziness or symptoms when in upright position, do not leave them for any reason. Call for assistance if needed. Let them sit there for a little bit, let them get their senses about them. If the individual has a weak side, make sure his or her strong side is facing the destination. So in other words, if you're trying to transfer them to the bed or to the wheelchair or the bedside commode, make sure that that's on their good, strong side. So you're always protecting their weak side. Then you lock the brakes on any of equipment that you're transferring to and from. Stand as close to the individual as possible. Stand in front, keeping your back straight, your knees slightly bent, and your feet at a wide stance. So that again, make sure that you keep that back straight and you use all of the leg muscles. Your leg muscles are gonna need to be the ones that will protect your back. Hold the individual at the waist rather than the arms or shoulders. Lean forward, grasp the belt on both sides, and then you've got to encourage them to participate by pushing up either on the arms of the chair, the arms of the wheelchair, the mattress, whatever they're sitting on. Encourage them to use those arms and get themselves up. That's less strain on you, and it also gives them a little more strength too. And turn towards the destination. So depending again, if their right side's their strongest side, make sure that your bedside commode, your wheelchair is on that side, and then you're gonna immediately turn them to that right side so then you can pivot them and set them back down. Make sure the individual can see the surface that they're transferring to, and always move your body in the direction that the transfer is taking place. And again, make sure that the individual is wearing shoes, so good shoes. No bare feet, none of the little hospital socks, even though they have the little grippers on the bottom. Unless, of course, you know, you're just going back and forth, but still on the whole, make sure they have good, solid footing underneath them. When the destination has been reached, gently lower and encourage the individual to use his or her arms towards the destination. And again, bear some of the weight, but allow them to bear some of the weight too. Remove the belt once they're comfortable, and of course, do all your transferring and make sure that they're safe before you leave them.